Introduction to Nursing Theory. Presentation by Group 4. Ida Jean Orlando. Born on August 12, 1926 and passed away November 28, 2007. She was a first-generation Irish-American born on August 12, 1926. She was an internationally known psychiatric health nurse, theorist, and researcher who developed the deliberative nursing process theory. She studied nursing and graduated in 1947 at New York Medical College. She received her Bachelor of Science degree in Public Health Nursing in 1951 at St. John's University in Brooklyn, New York. She completed her Master of Arts degree in Mental Health Nursing in 1954 in Columbia University in New York. Ida Jean Orlando had a diverse career working as a practitioner, consultant, researcher, and educator in nursing. She devoted her life to mental health and psychiatric nursing, working as a clinical nurse and researcher.
Careers and appointments. 1954. She became an associate professor of mental and psychiatric nursing at Yale University School of Nursing for 8 years. A federal grant was awarded, and she became a research associate and the principal project investigator of a National Mental Health Institute of the United States Public Health Service. Integration of mental health concept in a basic curriculum. 1958 to 1961. As an associate professor and director of the graduate program, she was able to use the proposed conceptual nursing model as the foundation for the program curriculum. From 1962 to 1972, Orlando served as a clinical nurse consultant at McLean Hospital in Belmont, Massachusetts. Orlando studied the interaction between the nurses and clients, other nurses and staff members, and how these interactions affected the nurse help to clients. She pursued the administration that there is a need for an educational program for nurses, and later on her nursing model was used in the educational program. She also served on the Harvard Community Health Plan Board in Boston, Massachusetts from 1972 to 1984. Orlando became an educator of Boston University School of Nursing in 1981 and held administrative positions from 1984 to 1987 at Metropolitan State Hospital in Waltham, Massachusetts. In September 1987, she became the Assistant Director of Nursing for Education and Research in the same institution. She was also a project consultant for the Mental Health Project for associate degree faculties created by the New England Board of Higher Education. Finally, in 1992, Orlando retired and received the Nursing Living Legend Award from Massachusetts Registered Nurse Association.
Why was the theory developed? Orlando's model was developed after being dissatisfied with the views that nurses were motivated to act as a result of orders from physicians, institutional policies, and other reasons, none of which related to nursing action based on meeting patients' needs. Deliberative nursing process theory. Orlando's nursing theory stresses the reciprocal relationship between patient and nurse. What the nurse and the patient say and do affects them both. She views nursing's professional function as finding out and meeting the patient's immediate need for help. Orlando's theory is a reflective practice theory that is based on discovering and resolving problematic situations. If the problem is not discovered, it cannot be solved. The centrality of the patient is ever present when using Orlando's theory. Orlando described her theory as a nursing process theory rather than effective nursing care theory. Orlando's theory contains concepts that are interrelated but are described separately. She described her model as revolving around these five major interrelated concepts. The first one is the function of professional nursing is the organizing principle, finding out and meeting the patient's immediate need for help. According to Orlando, nursing is responsive to individuals who suffer or anticipate a sense of helplessness. It is focused on the process of care in an immediate experience. It is concerned with providing direct assistance to individuals in whatever setting they are found for the purpose of avoiding, relieving, diminishing, or curing the individual's sense of helplessness. Second is presenting behavior is the patient's problematic situation. To find out the immediate need for help, the nurse must first recognize the situation as problematic. The presenting behavior of the patient, regardless of the form in which it appears, may represent a plea for help. The presenting behavior of the patient, the stimulus, causes an automatic internal response in the nurse, and the nurse behavior causes a response in the patient. Third one is immediate reaction is the internal response. Person perceives with any one of his five senses, organs an object or objects. The perception stimulate automatic thought. Each thought stimulate an automatic feeling. Then the person acts. The first three items taken together are defined as the person's immediate reaction. Fourth one is nursing process discipline is the investigation into the patient's needs. Any observation shared and explored with the patient is immediately useful in ascertaining and meeting his need or finding out that he is not in need at that time. The nurse does not assume that any aspect of her reaction to the patient is correct, helpful, or appropriate until she checks the validity of it in exploration with the patient. The nurse initiates a process of exploration to ascertain how the patient is affected by what she says or does. When the nurse does not explore with the patient her reaction, it seems reasonably certain that clear communication between them stops. The last one is improvement is the resolution to the patient's situation. It is not the nurse's activity that is evaluated, but rather its result. Whether the activity serves to help the patient communicate her or his need for help and how it is met. In each contact, the nurse repeats a process of learning how to help the individual patient.
Nursing metaparadigm consists of four concepts: person, environment, health, and nursing. Out of the four concepts, Orlando only included three in her theory of nursing process discipline. The first one is human being or person. Orlando uses the concept of human as she emphasizes individuality and the dynamic nature of the nurse-patient relationship. For her, humans in need are the focus of nursing practice. The second one is health. In Orlando's theory, health is replaced by a sense of helplessness as the initiator of necessity for nursing. She stated that nursing deals with individuals who require help. The third one is environment. Orlando completely disregarded the environment in her theory. She never mentioned the effect that the environment could have on the patient. The last one is nursing. Orlando speaks of nursing as unique and independent in its concerns for an individual's need for help in an immediate situation. The efforts to meet the individual's need for help are carried out in an interactive situation and in a disciplined manner that requires proper training. Assumptions. When patients cannot cope with their needs without help, they become distressed with feelings of helplessness. Patients are unique and individual in their responses. Nursing offers mothering and nursing analogous to an adult mothering and nurturing of a child. Nursing deals with people, environment, and health. Patients need help in communicating needs. They are uncomfortable and ambivalent about dependency needs. Human beings are able to be secretive or explicit about their needs, perceptions, thoughts, and feelings. The nurse-patient situation is dynamic. Actions and reactions are influenced by both nurse and patient. Human beings attach meanings to situations and actions that are not apparent to others. Nurses are concerned with needs that patients cannot meet their own. In 1958, Ida Jane Orlando began developing the nursing process is still evident in the nursing care today. According to Orlando's theory, The patient's behavior sets the nursing process in motion. Third, the nurse's knowledge to analyze and diagnose the behavior to determine the patient's needs. Application of the fundamental principles of critical thinking, client-centered approaches to treatment, goal-oriented tasks, evidence-based practice recommendations, and nursing intuition, the nursing process functions as a systematic guide to client-centered care with 5 subsequent steps. These are assessment, diagnosis, planning, implementation, and evaluation.
Next is the assessment, the first phase of nursing process, vital to assess patient holistical need. A nursing framework to obtain essential data that is subjective and objective to formulate a solution for the patient condition. Assessment include not only physiological data but also psychological, social, cultural, spiritual, economic, and lifestyle factors as well. For example, assess for respiration rate, rhythm, and depth sign of distress. Assess use accessory muscles and nutritional status, vital sign, and to obtain oxygen saturation, obtain health history. Next are the diagnosis. Use clinical judgment about the client's response to actual or potential health problems. Diagnosis confirmed using link to defining characteristics, related factors, and risk factors. Formulating a nursing diagnosis by employing clinical judgment assists in the planning and implementation of patient care. It is the basis of the nurse's care plan. Next is the planning. Based on the assessment and diagnosis, the nurse sets measurable and achievable short and long range goals for the patient. Participation of the nurse and patient. Act as patient advocates. Each problem identified is committed to a clear, measurable goal for the expected beneficial outcome. It provides direction for nursing intervention. Next is the intervention. Putting the plan into action. This stage of the nursing process in which the nurse will apply the formulated care plan to meet the goal of care for the patient. It involves action or doing and the actual carrying out of nursing intervention outlined in the plan of care. Nursing care implemented according to the care plan, so continuity of care for the patient during hospitalization and the preparation for the discharge needs to be assured. Care is documented in the patient record. Next is the evaluation. This final phase of the nursing process is vital to a positive patient outcome. It focuses on the change, what was done well and what needs to change. Information gathered, directed until improvement is seen. Both the patient status and effectiveness of the nursing care must be continuously evaluated and the care plan modified as needed.
Mistress Marcos, a 70-year-old divorced woman who lived in Hamilton Town, was admitted to the emergency ward with a chief complaint of shortness of breath, accompanied by a productive cough and fever. Patient is a heavy smoker for 15 years. When Nurse Elijah visited her bedside, she was having fast, shallow breathing. She can hear a slight wheezing. Her skin is cold and clammy. Her facial expression seems to be anxious. When she takes her vital signs, BP is 140/90, heart rate is 115 beats per minute, respiratory rate is 25 breaths per minute, and temperature is 38 degrees Celsius. She observed and confirmed if she's having a difficulty of breathing and asked if she's having any chest pain or feeling uncomfortable anywhere. Mrs. Marcos responded, "Yes, I'm having a slight difficulty breathing. This is the first time I'm having this feeling. I'm worried that this will get worse." Presenting behavior. What Nurse Elijah had seen, verbal and nonverbal, in an attempt to meet Mrs. Marcos' need. Subjective verbal behavior. Verbalized difficulty of breathing and anxiety over getting worse. Objective nonverbal. BP 140/90, heart rate 115, respiratory rate 25, and temperature 38 degrees. Action. Nurse Elijah's action. Informing Mrs. Marcos of any additional diagnostic procedure and treatment she needs. Mrs. Marcos is invited to engage in her care, giving attention on her feelings about her condition and any difficulty of breathing or any uncomfortable feeling she's experiencing. With every intervention, her engagement will be efficiently looked after. Reaction. Nurse Elijah reaction. I know how worried you might be feeling. I want you to know that it's okay to feel that way, but I will be looking after you in the entirety of your stay until you feel better. But I'm going to be with you the whole time. Is that how you're feeling? Mrs. Marcos responds, I feel more at ease now after you come and reassured me. Nurse Elijah responds, I will provide you your care and any necessary information and about your condition that you need to know in the duration of your stay. I'm here to help in whatever you want.
Clinical assessment. Subjective data. Complaint of difficult breathing and shortness of breath. Objective data. Productive cough, dyspnea, restlessness. Crackles on both lung field upon auscultation. Temperature 38 degrees Celsius. Respiration rate 25 breaths per minute. Pulse is 115 beats per minute. Blood pressure is 140 by 90 mm of mercury. Oxygen saturation is 85% in the room air. Nursing diagnosis. Ineffective breathing pattern related to existing medical condition as evidenced by shortness of breath and difficulty of breathing. Anxiety related to current medical condition as evidenced by fear and anxiousness. Increased body temperature related to the current condition as evidenced by temperature is 38 degrees Celsius. Ineffective airway clearance related to increased sputum production as evidenced by productive cough. Client's goal or planning. By the end of shift, the patient will be able to verbalize ease of breathing, normal oxygen saturation, relief from cough, breathe easily. Intervention and rationale. Administer oxygen therapy, provide comfortable positioning such as high Fowler position, reassess vital signs including oxygen saturation, reassess patient skin color and temperature, monitor patient mental status, side rail up for safety, monitor ABG for the appropriate level, make sure patient is communicating with the healthcare team or their family member is involved, encourage patient for deep breathing exercises, provide health teaching. Client evaluation. After the end of the shift, the patient ABG values and a pulse oximeter readings of sufficient oxygenation show improved airway patency, feels more at ease and is better able to express his wants. Ensure enough intake and output demonstrate that you are hydrated. Display no sign of anxiety, restlessness, or confusion. Acknowledges the dangers of cigarette smoking. Shows how to deep breathe exercise and coughing exercise.
I'm going to discuss about how does this theory or philosophy relate to 21st century nursing practice. Orlando's theory directly explains the nursing process and is the most vital theory in nursing practice. According to Orlando, the nursing care is provided for the individuals who are not in the capacity of the same themselves. It aligns with the universal nursing process of 21st century assessment, planning, and intervention. The use of Orlando's theory has been used over the centuries and increasingly in the 21st century in nurse administrator, leaders in practice, and by individual practice nurses. Orlando's nursing leadership theory includes nursing leadership development ideas for the new nurse. She identifies patients' distress and their immediate need for help. Nurses have always played a significant part in patient care. In the present time, that role is even more apparent. Nurses not only provide care that is safe and effective, and what it also focuses on all aspects of patient care. The use of Orlando's deliberative nursing process theory has spread throughout globally within the nursing practice. Nurses, both in nursing schools and in practice, including the healthcare settings and community health agencies, predominantly use Orlando's theory. Its use escalates the efficacy in fulfilling patient needs, improve staff nurses' decision making, and more easily determines nursing versus non-nursing functions. Orlando's theory provides framework to guide nurses' action and enhances nurses' functioning in the complex health environment. It sets principles that has been established in nursing education and nursing practice as well as in all aspects of nursing interaction. It has also systematized the standard of nursing practice. The theory's proposition harmonizes on how the nurse's responsibilities is intended to be more dynamic rather than passive when interacting with the patient. These are the references. This is the end of our group presentation. Thank you.